Well, good afternoon, everyone, and welcome to the seminar this afternoon, which I'm going to be chairing for us. I'm Anne Longfield and I have the privilege of being the specialist advisor to this committee for the report we're going to be discussing today. And for me, this is a really important report which looks at the role of public services in reducing and addressing child vulnerability. It's from the Lords Public Sector Committee, which clearly from the name you can see looks at the role of public services, and it's worked tirelessly, I've got to say, over the months from May through to October, hearing tens and tens of evidence sessions and talking to children and young people and their families too. And some of you may have seen the media coverage over recent weeks discussing some of the issues raised. And I think there's never been a more important time than we actually discuss and take action on these issues. I should warn you at this stage and remind you that we are recording this session, just so you know. We're going to talk for about 20 minutes or so with our speakers here, and then there will be an opportunity for questions. If you'd like to raise questions, you can do so in the question and answer box, and we'll then have a discussion after that. I'm really pleased to introduce the panel we've got today. We've got Baroness Hilary Armstrong, who chairs the Lords Public Sector Committee and who has led this report. We've got Jonathan Rallings, the Senior Policy Advisor at the County Councils Network. We've got Baroness Judith Blake of Leeds, formerly the leader of Leeds City Council, but also the chair previously of the Child and Young People Board of the LGA. And we've got Adetosoye, who is the Chief Executive of Bromley Council and also has clearly been a leading role in Solace as well. We're asking three core questions here as part of our discussion. How can public services help vulnerable children as early as possible to prevent the situation reaching crisis point? Why is addressing the current crisis in childhood vulnerability key to reducing inequalities across the country? And what might a national strategy on child vulnerability achieve? And how can it be implemented? So big meaty questions there, and ones that we have interrogated people on over recent months. But quite rightly, I'm going to turn to the chair of the committee, Baroness Hilary Armstrong, to kick off to tell us more about the report and what it tells us. Hilary.
Thanks very much, Anne. The report looked at how do public services serve vulnerable children, really, and it was a very difficult process because it's all very well us in Parliament opining on all these things, but in the meantime, as we've heard in the last 2 weeks, there are children in the middle of this, and children who are actually taking the consequences of us not being all able to get our act together and really make a difference for them. And the committee found that there probably are around 1 million children, more than 1 million children, who are vulnerable at this stage. And not all of them will end up in the terrible cases that we've just been heard reported in the last couple of weeks. But many of them will end up with their life chances reduced because the services are not there for them when their family need them. And that, if you like, is the crux of the report, that there should be support for families that is effective, because actually we do know how to do this in this country. We should get the right support in at the right time. And if we do that, then far fewer children will end up in the care system, vulnerable to the criminal justice system because they're vulnerable to perpetrators who lead them into the criminal justice system, and all of the other things that really have a detrimental effect on their lives and their life opportunities. They're the children who are missing from school. They're the children who are the targets of perpetrators. Perpetrators always seem to be a couple of steps ahead of anyone else. And we have a responsibility to make sure that services coordinate well at the local level, that they are able and they do share what they know about children, so that whichever is the most appropriate agency steps in at the right time. And they need to work effectively with the voluntary sector. And what the report said to government is that if it really wants to tackle levelling up, if it really wants to address the issues that have become far more live during the pandemic, then tackling the needs of vulnerable children through good early intervention programs is absolutely key. And the government are not spending enough money on that. They're not focused enough on that. This was an all-party and crossbench report, and we all agreed on that. So we have to up our game nationally, but we also at local level have to make sure that we work well together, and we do that in the interests of the children, and we work with the vulnerable first. I think that'll do, Anne.
Thank you. Trying to unmute.
You're fine. No, you've muted yourself now.
Oh, so
you've muted yourself. You're fine.
Right,
You're
I'm not
fine.
going to touch anything. I'm just going to talk while I can. I think the machine's taken over today, which is quite unnerving. Thanks, Hilary, so much for setting that out. And obviously, we're going to come back to what you have been talking about in our conversation. We're going to move on to Jonathan now, Jonathan Rallings from the County Council Network, but previously to that as well from Bernardo. So many years looking at these issues in massive depth. You had a report out, Jonathan, at the network a few weeks ago where you said there needed to be a much more investment in early intervention as well. And you've also said, you know, as a result of your own analysis, that you feel that there's going to be an increasing number of children heading towards the care system if there isn't investment and reform. So looking forward to hear what you can say. And I'm staying off mute because I might never get back on it.
Thanks, Anne. And it does feel a bit like Groundhog Day here, because I know you and me and many others, I'm sure on this this call, have sat around this table. And I think 10 years ago, it's about 10 years, if I'm right, that the Allen report came out, wasn't it? January 2011. And I think we genuinely thought we'd solved it. It was almost unprecedented. We had the leaders of the three main parties coming out, committing to this. You know what I mean? And it felt like a real high point after many years of actually saying we want to move forward. And I think one of the really interesting things I just want to touch on is why hasn't this sort of gone, you know, sort of from leaps and bounds? We've made some gains. We've got an early intervention foundation. We have a greater understanding, but we haven't made perhaps the sort of the push on the ground as our report has shown. And I think one of the things that really struck me is when I was working as assistant director at Bernardo's, we were part of a coalition of charities ahead of the 2015 general election to lobby to keep the gains that we'd made during that parliament. And we did a report called The Case for Early Support, which sort of reflected on these experiences a year after, and we worked with an external consultant, and she'd, you know, done an awful lot of work in the children's sector, but hadn't really looked at early intervention. I remember turning around to me and saying, I think the challenge with this is it's not a policy issue, it's a philosophy. And that really struck me. It's actually a collection, early intervention, for us to get it right, it's a collection of so many minute, tiny little decisions and little policy sort of ideas that happen right across from national through regional through local government. And I think with that, there's probably a bit of a link to levelling up as well, which is very similar sort of thing. So I think it's absolutely right that we should link it to levelling up. Obviously, the real issue for councils has been that austerity has put us in a really difficult position. I think you'd be hard pushed to find anybody within councils up and down the country that would not see the value of early intervention. I think the challenge has been that with the austerity that we've been facing, children's services budgets are very holistic, and council leaders and chief execs and others have had to make some very tough decisions. And when it comes to the children's budget, what can they actually sort of like make savings from? And those savings are not going to come from the statutory services for children in care. They're going to have to come from the other stuff, which can, you know, sort of usually end up impacting on your early intervention, whether that's your Sure Start centres or you work on the edge of care, all of that sort of thing. And I think that was really highlighted by the report that we've done, the really worrying, you know, sort of figures that we found. As you hinted, we're working with Newton, and we are hoping to get our report out in February, which will sort of set out what an optimised model for children's services should look like in terms of a reform process. But our worry is that projecting forward, the way that children in care numbers have been growing on current trends, we expect them to be as high as nearly 100,000 potentially by 2025, and that would be a massive high watermark. Underneath that, though, there's probably an even deeper sort of figure that sort of ties into this conversation, and that is that in about 2014, the proportion of local authority children's services budgets that were being spent on that statutory high-end children in care service was about 40%. It's currently now sitting at about 50%, and projecting forward, it will make up about 60% of the spending in local authorities by 2025 if we don't do something. So the case for early intervention could not be starker and clearer, because it's not actually going to save us money. What we're doing is we're just spending the money on poorer outcomes for children at the higher end of the system, where I think we'd all agree we'd prefer to be spending that money at the earlier end, where we're actually helping children to live a better life, as well as sort of saving some of those extreme costs or what have you. So what can we actually do about this going forward? And as I say, we're very much looking at what we can do as county councils to actually try and have a reform system, and that report will be coming out in February. But I think one thing that's really telling is that we think there needs to be a bit more of a sophisticated understanding about how we deal with ages and stages. Early intervention, you know what I mean, certainly within family hubs, and I know, Anne, you've done a hell of a lot around family hubs, particularly in sort of extending that Sure Start move to sort of look beyond just the under fives, but to look at sort of older children. And that's very important, because the children that are coming into the system, what we've learned is it's not new children coming in that's driving it. The big increase is teenagers, and that's because we're not getting kids out the other side. So we actually need to look at how we can do that edge of care work to help children to actually return out of the care system to their families, and that's just as important, early intervention. I think there's also something, councils are so often having to be motivated by where do we get the savings, and I think early intervention has often been packaged up as selling savings. But we had Josh McAllister come and speak to our conference the other week when we launched this report, and you know, we had a debate amongst our leaders and chief executives there, and we're saying that if we focus on the savings, we may well start missing the point. You know what I mean? And again, as I say, if you've got a pot of money, you want to be spending that hopefully on the early intervention, not on the late intervention. But if we constantly focus on the savings, you'll make those savings, and they will come back potentially to bite you by more children coming into the system later. But I think finally, I think we also need to as councils, be really confident about what we actually invest in and how we go forward. And I think there is too often a bit of a narrow focus on sort of very defined levels of evidence rather than actually listening to what we know what works. And I think we're all learning through this pandemic. The scientists are constantly, yesterday, Omicron, you know, it's looking good from South Africa, but we can't judge just on that data. We have to wait for more data to come in. And I think there's often been knee-jerk responses, family nurse partnership being an ideal example. We had a couple of sort of, you know, evaluations that said, oh, this is positive, this looks great, and then we had one came out that said, oh my gosh, actually this was in a country that doesn't actually have health visitors, it's probably not that efficacious in you know, sort of the UK, and councils panicked. oh my gosh, if we spent all our money wrongly. And actually, that doesn't necessarily mean the programme hasn't been good. We need to actually potentially hold our nerve and not have that blame culture. So there's just a few grenades to throw in. We could talk about this subject all afternoon, and hopefully we will. So I'll hand back to you now and wait for some questions.
Thanks, Jonathan. And I'd forgotten what a forensic knowledge you have, not only of the issue, but also the timescale within there. And, you know, right to remind us that this has been a conversation for many, many years. And also the example of family nurse partnership is something which is so important to remember, you know, good initiatives where, you know, interpretations of things can kind of, you know, send panic and the consequences of that. Baroness Judith Blake, we're going to come to you next, and I can't say this without talking about the fantastic outcomes that you have led in Leeds, you know, absolutely now recognised for leading the way in terms of so much around early intervention, but so many in terms of outcomes. And still, I think we should note that Leeds was one of the only cities to actually reduce child obesity. I know that was because you'd invested so much in those community services over time. But Judith, do you want to say a few words for us?
Yeah, thank you very much, Anne. And the difficulty with going third in a discussion like this is you listen to the other contributions and you know you want to pick up on so many issues. So like Jonathan, thinking about what I was going to say, you know, I can remember very clearly when we came back into administration in Leeds in 2010 and inherited an inadequate children's services. And I was given the role as the lead member for Children's Services as deputy leader of the council back then, and very much the tragedy, in a sense, very much the thinking then was related to the serious case reviews into the deaths of Victoria Climbié, baby P, and here we are again with two dreadful cases. I think they are absolutely dreadful. But the thing that it was drilled into me was to remember, yes, the terrible situations like this, the deaths of children, but the incredible scale of children who are suffering from different levels of neglect and the effect that that has on their lives and all of the manifestations that that come from that. So I want to start from the position of basically the conversations about this have been going on for a long time, and my question, and thank you for the report, and thank you, Hilary, for your wonderful chairing and bringing together such a broad group of people to come up with such a constructive report. But I think the thing that I'm wondering is why we've known, in a sense, what we need to do to bring the different relevant partners together. And we have to ask the question, why hasn't it happened? What have been the barriers to making this, the examples of good practice where it has happened, to making that consistent and rolled out across the country? And it's a fascinating thing for me. And I was very consciously aware of this when I was the lead member for Children's Services, that uniquely in local government, the DCS, the Director of Children's Services, and the lead member for Children's Services have a statutory responsibility for the well-being of children in their area. And that is fascinating for me, and it can take you into all sorts of areas. So, you know, many local authority areas have seen significant numbers of their schools, for example, becoming academies or in different forms of governance. And mostly we've achieved a good cooperation, but there has been some resistance from some of those chains to actually disclose information. And for me, that is unforgivable, given the sense of responsibility that the local authority has in that space, and still battling against, you know, the barriers of sharing of data and information. That is something that I think really requires a very deep look at. But looking back to the approach that we took, and myself and Nigel Richardson, who is the DCS that we brought in to help with the improvement journey, and he certainly did that. And we used to have this this quote from Ian Forster's Howard's End, only connect. That was her only message. And it so much is about relationships and how you make sure that you create the safe places for people to be able to disclose difficult information when they're not sure actually if there is a problem there, but their instinct tells them, for example, that something needs to be done, and how therefore you manage the whole area of risk. And what we saw after Victoria Klimbia, after baby P, was this terrible reaction from all of the agencies involved, and I'm talking about the police here, I'm talking about health here, as well as some local authorities, was to just, it was like to pass the hot potato, if you like, and just not be able to take responsibility for things that really were solvable within their own sphere of influence. And so we saw a massive increase in the number of referrals, incredible increase in numbers therefore going into care, the impact on budgets around that, and appropriate accommodation and appropriate settings for children. And then that came together almost in a perfect storm with the austerity agenda that we know has decimated the funding from 2010 onwards, and just how difficult that's been. And I'm afraid also the increase in poverty, in which we know has a huge connection to vulnerability of families as a whole, and therefore children. So I'm actually also on the design group of Josh McAllister's review, and we are drilling down into some really significant areas and hopefully drawing some of the conclusions together around that. And quite a lot of the focus has been on the whole area of family hubs, because that is an area that this government is supporting and putting finance into. So a lot of debate generated around, well, how does that compare with the Sure Start model, the early years, early help model? What will it mean extending that to 0 to 19? How will the resource be handled? So some very important questions there. But the area that I'm particularly interested in, and our experience showed us, I think we almost take it as a given that outcomes for children going into care, generally speaking, are problematic, and that unfortunately, given everything that we know, is still the case. What we did in Leeds was we made one of our obsessions to safely reduce the number of children coming into care, so really strengthening those local relationships, making sure that any concern was picked up, and the lead agency would be the most appropriate agency who had the confidence of the family to take it forward. And what we managed to do was reduce the number against the trend of young people coming into care, young children, as well as Jonathan said, the teenagers. That saved us millions of pounds a year, which we then were able to reinvest into the family group conferencing, early help, and build that process. I'm reducing this to the bare bones, obviously very complex picture, and some great outcomes. But so the area that I'm really keen to look at and to focus on from our experience is the whole area of kinship care, and how we can strengthen the support, recognise the significance of keeping children within a wider family network. It's not necessarily just grandparents, it can be much broader than that, and just how we can pull together to help that go forward. So some very important questions here. And I think it is, going back to the beginning of what I was saying, the fundamental question of why, when we've been talking about this and in some places doing it successfully, why it hasn't replicated in a way that I think we hoped it would. And there are a lot of support mechanisms going in to different areas that have struggled on this agenda, but clearly still a lot more to do, and I think the recommendations in this report will, hopefully the government will embrace those recommendations and really look seriously at what is being asked for and talk to the sector. Because what I knew as the lead member for Children's Services, in any meeting of the council as a whole, you had to keep banging the drum for children. It wasn't top of the list. It wasn't automatic that people would say, oh yes, we must make sure the investment is there for children, in the way that I think adult social care has captured the public space at the moment. And you'd have to keep pushing away at the children's agenda. Why that is the case, I really don't know, but unfortunately, from experience, I know that it is still happening, and we see the consequences of that. COVID has been immense, and we still don't know the full extent of the real damage that has unleashed, across so many communities. Sorry, Anne, I hope I didn't go on too long there.
No,
Thank you.
Thank you. Thank you, Judith. And really glad you mentioned the obsession word as well, because it has been an obsession at senior leadership within the local authority. And I think that's why you've managed to progress so much, because it was something which wasn't item 15 on the agenda. It really was a central obsession, and everything else had to relate to it. But I agree, you blink or look away, and actually others might not, in different situations, put children where they need to be. Okay, our final speaker is Adetosoye, and he's going to be talking about the journey you've led in Bromley, but also I think your wider work with Solace as well. But Addy, tell us about that, please.
Thank you, Anne, and thank you to colleagues in public service. I think as a nation, we do have a safe child protection and safeguarding service, but we need to give credit to colleagues who are in the front line, working day in, day out, supporting our vulnerable children. I recognise the current context, going back to what was said with baby Arthur, and also the recent case today. These are parents who are murdering their children. And I think we need to recognise that in the context that we work in local government, we really need to pause and give credit to our frontline staff going in every single day, protecting our most vulnerable children. The second thing to say, and I do welcome the report, which again sets out some of the fundamental changes that is required to support our vulnerable children in our society, and my thanks to Baroness Armstrong for chairing that. In the context of what we know in local government, what are the key issues impacting on the delivery of safe services? And I think it might be quite useful to begin from there. So we do know we've got an increase in the number of children in care, child protection numbers gone up, child in need numbers gone up. So we look at the current platform and the context that colleagues actually work in public services, in particular within local government. I think we're deluding ourselves as a society. I think we're not focusing on that real value of early intervention, which I'll come to. And I can actually say that a vast majority, if not all, colleagues in public services do recognise, of course, the value of early intervention. But one of the key issues that we continue to face, be 5-10 years ago, is that real sense of false economy, while going back to what Jonathan said earlier on in terms of any local authority chief exec, with the limited pot of money that we've actually got, the focus, rightly so, one can argue, will always be on statutory services. So that's actually quite delusional. I think it's a broken system, and I think it's a perfect storm. So my take on these in terms of the interventions have actually been in the past in terms of local government. The fundamental question is, what do we need to do really to get this balance right. And I think the answer is very clear in my mind, which is that we really need to get back to funding of local government and of public services in terms of early intervention. And I look at these in two parts. So you've actually got the early intervention delivered by colleagues within the voluntary sector, coordinated by public services. And I think until such a time that we go back to that, in terms of really going to some of the key savings that were taken out from the system, we're just going to keep wasting our time and actually failing our children. The second part, in terms of local government, we know for a fact that where you've actually got the involvement of local government, let's even think about the recent and the ongoing pandemic, the intervention of local government in vaccination programs, in shielding, in contact tracing, again, is another reason why we know fully well that the commitment of public servants really helping us to tackle the early intervention issues and all the vulnerability issues within local government are things that we do well. So I think for me, Anne, the 2-3 things that we really need to get right, and based on my own experience in transformation of children's services, if the funding isn't there, then the prioritization for senior leaders is actually distorted. So I think the first key thing we need to address as a society is actually funding. The second is the value we place on the work we do in supporting children. It simply cannot be right that as a society, it takes a lot really to get the agenda, children's issues in the forefront of our conversation. But yet when things go wrong, every single person that wants to talk about the failings in children's services. And I think we really need to get this right. The third for me, and going back to some of the key challenges, of course, we do know in local government, and again, services do link up together. I can actually go through today in Bromley to get a sense of the key children within my housing services, the housing officers are worried about, that education colleagues are worried about, that benefits people are worried about. So we can actually join up services. And I think we really need to invest in that real quantum. And I think, for me, there cannot be one answer, which is until funding's actually really resolved and really sorted out, the issues that we're trying to address today will not be. And the final point, just really to make sure we take some questions on, is actually that real sense. I've heard colleagues in central government say to me, how do you define investment in early intervention? And I say, well, the answer is the amount we put in acute services. That will keep going up. In the next 5-10 years, the number of kids in care, if this isn't resolved, will go up. Local authorities will struggle to support these children. And if we don't really put in the effort and the real intervention to really support the kids, who I know fully well, age 10, still in early intervention without support, might end up costing the local authority a year, 2 years down the line, $250,000. So the key for me is that real sense of purpose, the sense in terms of lobbying, the sense really to get the key services that we need at a very, very early intervention level. And without that, Anne, we're going to be sitting in the same place 10, 15, 20 years time, still talking about the issue. I'll stop there. Thank you, Anne.
Thank you, Addy, and thank you to all our speakers. I mean, I think we've got an extraordinary amount of consensus around what it will take to move to early intervention, but also a very clear message that this is something that absolutely is the right thing to do. And for anyone who looks at where this is going in terms of trajectory, I agree, it's absolutely unsustainable in both social and economic policy terms to carry on where we are. It just doesn't work. So we're going to, just a reminder to put your any questions or comments in the Q&A, but I just wanted to kick one off with the third question we had on our list, which you haven't really kind of answered, but one of the things that the report talked about and asked everyone who came along what they thought was about the merits of having a national strategy for vulnerable children and to reduce vulnerability, essentially. And I just wondered what people thought about that. Did they think it was a nice to have? Do they think it would get in the way? Do you think it's absolutely essential? And if so, what would it look like and how could it be positively implemented? I mean, Baroness Armstrong, do you just want to kick off, because you know in the report that's something that came through loud and clear?
I think we thought that unless the government gets a national strategy and really takes this as a priority that they can be held accountable for, then the level of cooperation across government and the determination to actually move from only dealing with crisis to actually, as I was earlier saying, getting the help into families when they need it in order to prevent some of the things going wrong down the line, unless you have that determination at national level and an understanding of what it is each department has got to do in order to contribute to actually facing this challenge. I think it's one of the most serious challenges we'll face coming out of the pandemic. Then we will do what everybody's been talking about. We'll keep talking about it for years and years and years. And you made me feel very old, Jonathan, because I've been talking about this for a lot longer than 10 years, I'm afraid. My time in government, I spent a lot of it on this very issue. And of course, I was the minister that actually introduced the Family Nurse Partnership. So, you know, I care about these things passionately, but I started my career in this over 50 years ago, and I felt it strongly then. And unless government takes hold of this as an A-line priority, I mean, in my day, the chief executive at South Tyneside, who was then a woman called Irene Lucas, who came to the department later, she set for every department in the authority a priority 1 year. What are you doing in your department for children in the care system? So the IT department had to think about it. The cleansing department had to think about it. Every department had to think what their contribution as a public servant was. Now, in the sense, what I'm saying is government has got to have that sort of mindset, as well as people in the place, the locality, having that sort of mindset.
Addy, what do you think about national strategy? Would you like it, hate it?
I think just really going back to what Baroness Armstrong said, I welcome this, but as long as the funding challenge is actually addressed, that is the fundamental issue. Of course, I can see the real benefit in terms of the co-production between departments. I can see the benefits in terms of outcomes across central government departments. I can see the benefits in terms of data sharing. And I can also see the benefit in terms of the wider oversight of children's issues within central government. But one of the key things, if one's actually redesigning a system, in local government, we do have children's services. It takes account of a vast majority of services to children's services in one place. And we do have a statutory director and the link as well in terms of that clarity around political leadership. Wouldn't it be great, I say, whereby in central government, you do, my last count, 4 or 5 departments chasing the same agenda. Of course, that is a recipe for disaster. And in the absence of that, of course, whilst my own preference would be coordinate all the key services to children's services, vulnerable children, through one single department, one single line of accountability, I think this perhaps will turbocharge some of the key things we're trying to achieve. In the absence of that, of course, then the strategy, if we're funded with the key attributes that I mentioned, will work. And I think one of the key points you raised in terms of implementation, I joke about this every time. Again, in my days, training as a social worker, there is power in Section 17 of the Children Act, 1989. You know, it gives us that statutory footing. It gives us some of the key things that we're still asking for, which is the statutory duty on local government to support any child in need. You know, that wasn't quantified, but actually saying we are really supporting kids in care. This again does take account of Section 17 in terms of early intervention, and it sets out some of the key requirements. So for me, there is a way that we can easily get these implemented pretty soon by just focusing on Section 17. But as I said, with the exception of that, a wider strategy that addresses the funding issues, I think are welcome.
Okay, thank you. Okay, so we're going to go to questions. Going to start with Helen Jones. And Helen says she is aware of the matters picked up by the committee about the lack of unifying policy. It's very related to the point about a national strategy where vulnerable children had different outcomes in different departments across government and held then separate pieces of the agenda rather than seeing them in the whole. The question is, how can this translate into shared outcome measures? There's also a question about if government's responded to this recommendation. But Baroness Blake, I wondered if you might tell us a little bit more about how you managed to have that priority and those outcome measures, and how you think that can be done across government too.
So the methodology we used was outcome-based accountability, and bringing different interest groups from across the whole. So it's not just about the local authority, it's about the locality as place, and bringing everyone together and asking them to consider from their perspective, as Hilary said, what is their contact with children, their responsibility for the children's agenda, where does their contribution come from, but set against that you have a very clear sense of what it is that you're trying to have an impact on. And then, of course, to be successful in that, you have to have a very clear framework for how you're measuring it. The slight concern I've got with the recommendation is the mention of the word targets, because I'm not sure that that's quite the approach that, you know, what we know is if we have a real focus on the number of young people with mental health issues, the numbers will go through the roof because there is so much unrecorded need out there. So we just have to frame it in a way that we don't shoot ourselves in the foot, I think, from the outset. And then it's that whole issue of making it everyone's responsibility to contribute to the agenda, to understand the impact they're having, and that absolutely beautiful thing, you know, when you ask people what they are doing and what contribution it's making, and the number of people that are doing things that make no contribution, and the question, well, why are you still doing it? And it, you know, change is difficult, and I think it is that change management. We talk about it in terms of reform of local services, don't we? So I think actually local government, local communities, that whole debate about place has moved on a great deal. And within that, then you can bring the business community in. So you then start talking about the skills agenda, education, training, support, and all of those things. But I've only been in Westminster since March this year, probably a bit later even, and I get the sense that the departments here are much more solid, the boundaries between them, and I really think it was a huge mistake to change the name of the department to Department for Education, and then it's suddenly, well, who is responsible for children? And part of you thinks, well, how was that allowed to happen? So I think what we need, because I think the need is enormous here to get this to the top of the agenda, as it has been outlined in the report, is I would actually recommend that there needs to be someone at the cabinet table with responsibility for children and families. You know, really, and just, this is so serious, the situation that we're in, and likely to get worse. And I think we need someone who holds the ring and can really make sure that every single department in government is mindful of their responsibility in this area and contributing and really making the difference that needs to happen.
Jonathan, would the network support both a national strategy and someone at the cabinet table? Is that something that we can count the network in on?
I mean, I think certainly anybody who's interested in children's policy has been supportive of the idea of a cabinet level children and families minister for many years, and I don't think County Council's network or any of our lead members for children and families would have you know, sort of much opposition to that. I think though, one of the things that we need to be really careful about with this agenda is, again, I noticed the term outcome measures is coming in, and that is really important to actually drive stuff forward. But at the same point, I think we also need to realise that some of the things that can actually, this is about cultural change. As I say, it's a philosophy. It's not just about individual policies. And if we want to get that buy-in, you know, I think we've had talk before, I know, in the sector about, you know, sort of more child impact assessments, a bit like equality impact assessments, which can go quite a long way to just getting people to think through policies and to think through, you know, sort of what the impact may be on children. I think one department, I cover all of social care at the County Council network, one department that could really do with that is the DHSC, you know, and I'm pleased that it's mentioned within the report about the, you know, the fact that we have got health and care bill going through that's going to set up entirely new health structures, and children's health isn't brought out. Now, if you had a child impact assessment, how quickly would that have been picked up for something like that bill to actually say that there needs to be more? But I think the things that actually work quite well with cultural change, in my experience in my career, would be things like, I hesitate to say it because it's previous government, but Every Child Matters was, at least for the sector and for the professionals, quite clear in terms of actually these are the things that we need to be aiming for, and maybe we need to think about something that can work for early intervention that has that guidance, and you know what I mean, that would actually put it in there. I know it worked well to try and tailor something nationally within an organisation like Barnardo's when I was there. Our early intervention investment for our early years was about actually something that could improve attachment between mums and children. And I was told at the outset, nobody's ever managed to get something right across Barnardo's, you know, across all 4 nations, all parts of England. But the reason it worked is we took the 5 to Thrive approach, and it's not a programme. So everybody had their individual programs, but because this was a broad approach that described attachment to professionals and then said to them, and how would you use this knowledge to then describe that to the parents you're working with, we had some amazing creativity, and people were able to run off and to actually do stuff with it that could actually fit to a national strategy, but also work to the local level. And I think, you know, we need to, but what we do need to be wary of, I know that we're going to need outcomes measures, but we need to be wary about them being put right at the front rather than actually thinking about, let's get the cultural change right, and the outcome measures will come out of that.
Yeah, wise words there. I'm going to morph a couple of questions or points that a number of people brought up. Katrina Moore and Jonathan Knott too. There's a question about what happens when children are made more vulnerable because they don't get that early intervention, but also what I'm morphing into is, what are your concerns if there's another lockdown? Do you think that these are going to be heightened too? And Baroness Armstrong, I'm going to ask you that, because I know you've been asked that quite a lot over the last few days and weeks.
Yes, I firstly to answer, I think it was Catriona question. Yes, we did think about those children who have got special education needs, learning difficulties, disabilities, whatever. They, of course, can become vulnerable if they don't get the right support at the right time, and if their families don't get that right support. So yes, they were certainly within the categories that we were looking at. But the issue around a lockdown, I hope we've learnt the lessons from the last lockdown. We cannot let children disappear. And whatever that takes, if it means that, you know, care workers have got to have extra jobs or whatever. I actually don't care. The idea that children are not seen by health visitors, are not seen by social workers, are not seen by, are not able to find out. I mean, that's one of the good things about some of the work on the family hubs, that they, some of them are talking about a sort of virtual network, making sure that even in the areas, the households and the families where they've not got much money, they do have access to computers and to Wi-Fi, so that the mothers could talk to each other as well, and they can see what need, you know, they can see each other's children and they can talk to each other about breastfeeding or whatever it might be. We have to make sure that the families are not isolated and that the children are not lost. And somehow that is a hugely difficult message. I agree with Ade that we have enormous, we need to be enormously grateful to all public servants for what they've been doing. But somehow we have to make sure that children don't get lost if there's another lockdown.
Yeah, absolutely. I think everyone agrees with that. So we've got 7 minutes left because we only have an hour for this, even though we could all carry on for weeks probably. There are two particular issues I want to bring up because they were central to the considerations of the report, and we'll bring them up, but people can decide what they focus on. One is by Kathleen Caper at the Cabinet Office, which is, are there barriers to accessing the data you need to enable identification of vulnerable children at an earlier stage? And then an earlier question about Lucy Shepherd, who's saying, really pleased to see the voluntary sector and charities being in there, acknowledging that, you know, measurement and evaluation is really important in there, but how do we implement that? How do we make it happen? So two of the kind of really important conversations, one about how you broaden it up to a wider sector and charities and voluntary sector, and then the other one, which just kept coming back time and time again, about data and what are the barriers. And Kathleen, I know there are people all over government asking those questions as well. So Addy, do you want to kick off in either of those as kind of, yeah, your penultimate question? I'll come back to each other's final word, but if you could be brief, that'd be good.
Just three key points. The first, really, to echo what Baroness Armstrong said. I worry about the lockdown. I think the lack of protective factors whereby kids won't be in education, GPs, the voluntary sector, children's centres, the social support context will be there. So it's one that I worry about. I addressed my group of social workers today. That's exactly what we're discussing. The second point, in terms of data sharing, I think once you've got a child within the context of safeguarding, that's actually okay. Where you've got the real challenge is actually in the early intervention stage. So I think the report from Baroness Armstrong was very clear. We need to do more. And then the third point I picked up on the recruitment issue. Is we need to address the pay of frontline staff, you know, full stop. I think that is the only way. If we cannot address that, then we're just going to keep going round and round. Thank you, Anne.
Brilliant. Baroness Blake, either of those. I've got a fear that we're going to be cut off in 5 minutes, so just to warn.
Well, so the interesting thing, we've got the police and crime bill going through at the moment. And I've picked up some of the issues about illegal evictions, and the powers are there for data sharing for the different agencies to work together, but often they don't do it. So we're saying that there needs to be a duty there to share that information. And I think there, you know, we need to look at, you know, very carefully at the areas where things aren't working, because what we know is homelessness massively increases the vulnerability of young people, particularly if they're in areas at risk of gang violence and those areas. So, you know, it's very frustrating when you're told, well, actually the powers already exist and we don't need to do any more. But if we've got the evidence that it's not working, then that's what we need to be able to feed through and say there need to be better ways of doing this. With regard to going into another lockdown, one of the problems was with the first lockdown that health visitors were actually withdrawn from their roles and taken out of that role and put onto the front line dealing with COVID, and I think we have to learn from those mistakes, if you like, and make sure that the wraparound provision is maintained, and we come up with different exemptions so that face-to-face contact can take place.
Great, thank you. Jonathan, what about the voluntary sector? You used to be in it, now you're in
it. The evaluation thing I've thought about intensely across the public sector, the voluntary sector and the private sector, actually, at various points. I think one of the real challenges is, and I've tried to put this before, we actually need more intelligent commissioning around evaluation and how we use it, because what we are often trying to measure with early intervention are outcomes that are years, decades in the future. And I know I could go to, you know, a minister and say, I've got this perfect, it's 100% efficacy, we've evaluated it, it's brilliant, and they'd say, oh brilliant, well tell us all more about it. It's like, well, we started our study in 1954 and this cohort of children, and they'd be like, well, that's got no relevance to what we need in 2022. And I think what we need to do is move towards science-based commissioning, where we actually take a look at what the science behind what we're basing, you know, sort of an intervention on is, and actually saying that's probably a good bet, isn't it? You know, there's actually a huge amount of research showing, and a really good example of that is the extensive work we've done over the last 20-30 years in understanding attachment trauma, how children react to that, how they behave and what have you. If it's based on those principles, an intervention is probably going to be great. You don't actually need, and this is, you know, the same with family nurse partnership, you know, one particular study done in a particular town at a particular time. But I have heard people in my career talk about, oh, well, the great thing is if we bring in program X, it means we've got guaranteed 69% success rate. It's like, no, that doesn't what it mean, you know, that isn't what it means. So we probably just need to be at all levels, commissioner level, right down to the voluntary sector, a bit more intelligent about what we're doing, and actually try and couch a little bit more, well, this approach is based on, you know, this science, and this is why we're pretty convinced it's going to work, because we've got this decades of research. But that is probably somewhere that we really do need to make quite a lot of advances if we're going to actually achieve the aspirations of this report, I would say. In terms of barriers, one very quick thing, Anne. In terms of barriers, I think it's less that we've heard about barriers to data sharing where I am at the moment, and certainly the research that we've been doing for the report we're preparing at the moment is actually, it's more local authorities being able to actually access certain services. So actually being able to access mental health services, to be able to actually get schools engaging and getting partners working. So I think it's less now to do with the data sharing than it was 10-15 years ago. It's more about actually just being able to get that collaboration going. I don't know if Addy's nodding, so I'm hoping that he's seeing the same in the London Borough.
There's a whole new seminar there on coordination, cooperation, though I do have to say that data sharing came up, you know, very often, even though we didn't, the members always didn't encourage that instantly. No, it always came up, so it was always a point of question. We're coming towards the end. Baroness Armstrong, I think I need to come to you for your final word, really, in terms of the report. I mean, I think this is a crucial report at a crucial time, and clearly, you know, the committee's got real standing there, and this has been put forward as a cross-party report to government. What would be your kind of lasting words on it for us?
I think it's clear that children have got to become a much higher priority in the eyes of government and in the eyes of local services. And we have to recognise that as a society, we have a responsibility to the next generations. And unless we take seriously what it is that actually will enable them to develop the resilience, the knowledge, the well-being to be good citizens and active workers, then we as a society will lose. It's in all of our interests to actually make sure these things work, whether it's data sharing. And we're working with the Information Commissioner to actually persuade them that there needs to be a separate attention paid to the public sector. It's not like regulating companies where they're into just protecting the independence and liberty of the individual. This is about the protection of children. And yes, legally, you can do what you want, not what you want, but you can do anything that you need to protect children. But people don't understand that. And it is about putting a priority onto early intervention. And that means shifting the funding, making sure local areas have got the funding to intervene when the family need that intervention. I could go on, but we're over time. I'm sorry, Anne.
No, thank you. Really powerful there. Point to leave us on. It has to be purposeful and intentional, and that shift has to take place. Thank you so much to all the contributors this afternoon. I think what you can see is just massive amount of experience here and knowledge, but also wisdom in terms of not only needs to happen, but what could be. And thank you for everyone for joining us. Please keep in touch with the work of the committee and important work and new inquiries to come. But also, please, I know you do this every day. Please do continue to push for the things we've been talking about today, because it is what will make the difference. And it's never been as important as I think it is today. So thanks to everyone. Thank you for your time. And we look forward to continuing to work with you. Thank you.